Well, good morning, folks. John Adamson with Seeking Light. Hope you are doing well. I don't know if you've been following this at all in the news, but there's been increasing reports of excessive death rates in certain age groups, most particularly in the younger age population. Excuse me. So we're talking young adults and even late teens, and then middle agers like myself. So, where are these reports coming from? Well, two countries that are particularly reporting right now would include the United Kingdom, more specifically Scotland and Australia. And they're coming out with numbers related to age-related or age-specific death rates. I was just reading up on the Scottish data, and they were pointing out that they were comparing data of the current death rate to the 4 years preceding the COVID outbreak, but they did include 1 year after the COVID outbreak. So they were including, I want to say it was 2016 through 2019, and then also including 2021, which seemed odd. But one of the conclusions they came to was an overall death rate of almost 11% increase in death rate. And I'd heard a report about the Australian data, which suggested actually a much higher death rate. And so the question is, what's causing this increased death rate? Because according to the Australian data, their death rate is far exceeding their birth rate right now. So what could be creating this discrepancy? What could be causing this higher mortality rate? Well, one thing that the data seems to suggest is that they've ruled out the deaths from COVID itself. So you have a diagnosis of COVID, you die, your death is chalked up to COVID. So they've ruled out any link to the COVID vaccine for these excessive death rates. So now what are you left with? Well, all other factors, right? So then you start to look for correlations. What has caused a massive uptick in death rates currently, winter of 2022, 2023? Why is our death rate so much higher now than it was in the years preceding the pandemic? And so you start to see what's changed about society. Has anything changed significantly about air quality that would impact all people? Has anything changed significantly about lifestyle patterns? Now, obviously, during the lockdowns, it has been shown that people did increase unhealthy habits during the lockdowns. So they ate more, they exercised less, they socialized less. So that all these factors from lockdowns would play into perhaps their morbidity, so diseases which can lead to death or disability, and mortality leading to their actual death. But the question is, would those morbidity and mortality rates increase that dramatically in such a short time due to 1-2 years of lockdown and altered lifestyles? So that's a question that needs to be asked. But one thing that you're not going to see, at least published in the major news media, and one thing that you're not going to see the talking heads that are responsible for our government talk about, is the possibility that some medical intervention that's been largely pushed on the public may be responsible for these excessive death rates in both the UK and Australia. They won't do that. They're afraid to. But why should they be afraid? You know, if we're called to follow the science, We should be willing to look at all evidence of something going on and look for the root cause. And whatever that root cause might be, we should investigate it, address it, and educate people about it. But they won't do that. Why? Because a lot of people have made a lot of money. And because if they were to admit that there's a very likely strong root cause in a medical procedure that they've pushed on the general public, their careers are over and they will be publicly disgraced. Suppose you're in a position, let's say of a large country, and about 350, 380, I forget what we're up to, million people look to you as being a public figure to promote what is good and true and not promote that which is evil and false. And it's found out that what you've been pushing on the public for so long actually is evil and false. Imagine how much face you would lose, how much credibility. And if you were to personally acknowledge your role in what's happened, from an increased death rate, let's say, imagine the guilt and the devastation to you personally and psychologically. I know I have enough of a conscience, and I believe given by the Holy Spirit, that if I discovered that something I had done potentially had led to the excessive death rates of a large number of people, it would crush me psychologically and really shake me to the core of my being. But we're not dealing with people that generally demonstrate a strong level of consciousness about human society. They're more conscious of the lusts of their flesh, their eyes, and the boastful pride of life. But I digress. So look at, you can easily Google death rates for Australia and UK. And if you center your searches on Google around things like sudden cardiac events, that'll help you further refine your searches. There's some work by a cardiologist in the UK. I do believe his last name is Aneen. I may be saying that wrong. I think it's spelled Aneen, but I may be wrong. And so, but maybe with that spelling and UK and cardiologist, you'll find his work. But he's done a lot of research about this, precipitated by the very unexpected and rapid death of his doctor, of his father, who is also a doctor, who had a very healthy lifestyle and good health profile, and then had a very rapid death after receiving a certain medical procedure, which you know what I'm talking about, that kind of opened this particular doctor's eyes to the possibility that we were being fed a load of you-know-what. Anyway, I hope you're doing well today. I've got an absolutely beautiful sunrise coming up behind me. It is going to be a beautiful day because the Lord has given us this day. Anyway, I hope you're doing well. Don't forget to like and subscribe, comment. I know I've got a small audience that actually watches these lives, but sometimes topics are interesting to people, and your feedback is definitely appreciated. Take care. God bless.